Come in.
Good morning, doctor.
Good morning.
So did you get my son's blood test results back?
Yes, I did. Now I know the reason for your fatigue. You are vitamin D deficient.
Well, doctor, what's vitamin D? And what does this mean?
Don't worry, I'll tell you everything you need to know about it.
Vitamin D is required for normal human physiology. The main two types needed are vitamins D2 and D3. We can get it from certain foods like salmon, eggs and fortified milk. But the most important source is UVB rays from sun exposure. But not too much, else it could lead to cancer. Vitamin D from food sources in the sun is biologically inactive. It needs to be converted to the biologically active form calcitriol. This is a hormone which is then released into the bloodstream. It then travels to the target organs where it is needed. Vitamin D is important for regulating calcium and phosphate levels. Stimulated by PDH secretion, it helps increase calcium in the blood. This is carried out by absorption from the small intestine, liver and bone. Calcidiol levels are checked by a 25-hydroxy-vitamin D test. The normal blood levels of vitamin D are 20 to 50 nanograms per milliliter. Blood levels of less than 12 nanogram per milliliter is known as vitamin D deficiency.
Vitamin D deficiency? What happens in that? Is my son going to be alright?
Vitamin D deficiency can cause fatigue, joint pain, weight gain, headaches, muscle cramps, high blood pressure, to name just a few. And at a more serious level can cause diseases like rickets and osteomalacia, heart problems and asthma.
But how does this happen? What caused this? Did I do something wrong?
There are three main causes related to this, the first one being diet. If vitamin D is not consumed enough, there could be a deficiency. The second is not having enough sun exposure, but that's not surprising when there's hardly any sun in this country. The third cause may be dark skin because melanin prevents production of vitamin D from sun exposure, but clearly this is not the cause. This means he is not getting sufficient vitamin D from his diet.
So doctor, what's the next step?
Don't worry, your son will need to take high-dose vitamin D supplements. He must not take more than 50,000 IU per week. We will check his vitamin D blood levels in 3 weeks and see if there's any improvement. We can continue with the normal daily supplements.
Well, thank you, doctor.
You're welcome. See you soon.
Thank
Bye.
you.